Hello, and welcome to the Health in Europe podcast. I'm your host, Greg Bianchi. We've launched this podcast to bring you the latest on WHO's work in the European region. Our region is broad and diverse, from the mid-Atlantic and stretching as far as the Chinese border. We work with fascinating and driven individuals and groups. This podcast is about hearing their stories and how it might impact your day-to-day life. Now, would you buy or consume a product without knowing what's in it? What about one that's known to cause a range of diseases, including cancer? Would you expect these products to carry a warning or at least a list of ingredients? Well, across the WHO European region, only 9 of 53 member states have laws that request alcohol producers to provide a list of ingredients, nutritional information, and health warnings. What's more, in many countries, providing this information is voluntary rather than obligatory. That's one finding from a recent Health Evidence Network synthesis report on alcohol labelling produced by WHO's European Office for the Prevention and Control of Non-Communicable Diseases, or NCDs. NCDs are diseases that can't be transmitted to other people, so think conditions like cancer, diabetes, or heart disease. Hi Karina, can you hear me?
Hi Greg. Yes, I can hear you.
Hi Karina, how are things?
Fine, thank you. Very busy.
Karina is the Programme Manager at WHO's European Office for the Prevention and Control of NCDs. Her focus is on alcohol and illicit drugs. I asked her a bit about the impact of alcohol in the WHO European region.
So the situation in the region is that we have from all the regions of WHO the highest levels of alcohol consumption in the world. So basically, we know that alcohol is responsible for about 3 million deaths each year, which is caused by alcohol consumption. And in the region, we are talking about 1 million deaths per year. So very huge burden in terms of alcohol-related deaths. In fact, 10% of all the deaths that are occurring in our region are linked to alcohol.
Okay, so I mean those are obviously quite big figures what you've quoted there. Are consumers being made aware of the associated health risks of drinking alcohol?
Well, that's what we're trying to we try to systemize and analyze in our WHO Health Evidence Network synthesis report. So this is looking at all the evidence that we have about alcohol labeling, which would be a way to make consumers aware of the associated health risks of drinking. So it's the first time that we're having such type of study, and we're looking at different alcohol labeling practices across Europe. And we found that only 9 out of the 53 member states in the region have laws that request alcohol producers to include the necessary information that would provide awareness and therefore would let people be able to decide. So this would include information on ingredients, nutritional and health warnings. Many countries, what happens is that at the end, many countries are basically convening this information only in a voluntary basis rather than mandatory. So this means that most of the alcoholic beverages do not provide such type of information. So we have some alcoholic beverages that might be high in sugar, for example. So you would not be able to know the nutritional value of that alcoholic beverage. And so this means that many people remain uninformed that alcohol is very high in calories and calories that basically provide no nutritional value. In some countries, for example, you have also labeling that provides information on ingredients only. And countries where they only display health warnings or information on energy intakes of drinks. But as a whole, we have very few countries providing all this information together, which is essential information for consumers to be able to assess the risks and made the decisions regarding drinking alcohol.
Okay, I mean, To me, that seems quite surprising when you consider the range of warning labels on a number of other products that can lead to these sorts of health problems.
Yeah, it's very surprising. And what we see in the region is that we do not have any country, that has achieved best practices for alcohol labeling policy. We see that in the eastern part of the region, there are countries that made progress, especially regarding the warning labels. So countries that decided to have at least 20% labels dedicated to warning messages. But we know that everyone can do more. So this is what we expect also with this report. We have evidence that labeling is very important for increasing awareness, for allowing people to decide and reduce their drinking consumption, which is very important. And we saw that countries that follow comprehensive policies on alcohol can have a big impact in terms of their mortality and in terms of their life expectancy. So this is what happened in Russia, and this case has been documented. So they have implemented policies which relate to labeling, but not only, because labeling is just one part of the comprehensive policy response that the country needs to put in place. But they are very important to raise awareness from the consumers.
Well, I mean, it's really important to move towards a situation where consumers are given the opportunity to know more of what's in the bottle of any alcoholic beverage, like any other foodstuff.
João is head of WHO's European Office for the Prevention and Control of NCDs. I asked him what more policymakers can do.
They can do a lot, because much of the regulations in terms of labeling, they are decided at sometimes national level, other times at supranational levels. So sometimes it's in the European Union context or the Eurasian Economic Union context. Some other times we have 53 member states. So there are different circumstances, but it is really the regulatory bodies in the countries and policymakers that take the decision to improve the labeling of alcoholic beverages, which is one of the areas that can and needs to be improved in terms of the alcohol good buys and best buys. These interventions have been identified and described, and certainly better labeling is one of the areas that could have an impact, a positive contribution, and therefore this is the role of policymakers in this context. Only they can take that decision to improve regulation and mandatory labeling in this context. Of course, companies can also do a lot, right? And there are things that companies can do on a voluntary basis. There are things that they can do, for example, in reducing the amount of alcohol in the beverages.
What can they do to build, say, public support for something like this?
Well, I mean, I think there is already a lot of public support, because if you ask consumers and consumer panels, consumer surveys, when you ask about labeling of foods in general, foodstuffs, right? They always want front of pack labeling. They like interpretative front of pack labeling, which is the same as to say, it could be traffic lights, could be Nutri-Score. There are many options around the world, and in Europe, different countries use different options. So the consumers like the color coding, they like the information on the front of the pack, and they like really more and better labeling. So consumers across the board, they want better labeling.
So, With public support and evidence suggesting that alcohol labelling works, what's holding this up? I put this to Karina.
Well, their interest is in selling alcohol. It's not public health interest. So, of course, they can make very strong opposition for having these kind of labels in the beverages. If you are going to buy a product that is saying, like for tobacco products, that there's a strong warning, for the health impact that this can have in your body, you will think twice. And this is not a policy that those who want to sell more would like to see in their products. So this is what is basically slowing down this process. There's a lot of resistance of including this type of messages, high levels of calories or warning labels in products that will probably make the consumers think twice before they buy their products.
Excellent. Thank you, Karina.
Bye, Greg. Bye.
Here's what else has been going on around the WHO European region.
Доброе утро, добрый день. Спасибо, что вы нашли время, чтобы принять участие.
During a Russian language virtual press briefing, WHO's Regional Director for Europe, Dr. Hans Kluge, warned that while the number of COVID-19 cases has stabilised, the virus remains a threat to countries across the region. On World Blood Donor Day, WHO thanked voluntary unpaid blood donors for donating blood, while also raising awareness about the importance of regular blood donations for individuals and communities. And finally, do you want to help influence the future of health in Europe? WHO has launched an online consultation on the European Programme of Work, United Action for Better Health. This will set out the priorities for WHO's work in our region over the coming years. Find out more on our website. That's all for this edition of Health in Europe. If you want to find out more about the HEN alcohol labelling report, you can visit our website euro.who.int and follow us on Twitter @WHO_Europe, Facebook @WHO Europe, and Instagram @WHO Europe. In July, WHO will be releasing 2 new reports on alcohol, one on the impact of pricing policies and another on the regulation of marketing of alcohol. Thank you to Karina Ferrer-Borges and Dr. Joao Breda for taking part in the interviews today. Thanks also to David Barrett and Alexandra Olsen for their help in producing and researching this episode. Thanks for listening, and until next time, stay safe and stay healthy.